Hi, my name's Ian Taylor from Wolverhampton. I'm a community psychiatric nurse and I've been for 43 years. I was diagnosed in March 2023 with prostate cancer. I initially went to my GP. No symptoms really, just a bit concerned about urgency on passing urine. Some bloods were done. Luckily, he did a PSA, and that was slightly raised. I got a call asking me to come in, and I had a rectal digital exam, which then indicated a fast track for prostate cancer. This happened very quickly. Referred to New Cross Hospital and had an MRI, which showed Priads 4 and 5. This then was a biopsy was requested, which it proved prostate cancer low grade, Gleason 3 plus 3, 6. And the advice was active surveillance with no treatment and a MRI 12 months following that. So 3-monthly PSA tests, which each month rose slightly. So they started 6.8, they ended up at 16.8. Annual MRI showed spread of the disease, which followed a further biopsy, which showed a more aggressive cancer. Gleason score 4 plus 3, 7, and the advice was a radical robotic prostatectomy, which I opted in for. The 18 months of active surveillance were very anxiety provoking and preoccupied following the PSA blood test until I got the result. Underlying anxieties knowing that I got this cancer and it was inside of me, despite the reassurances that I might die with it rather than from it. So when it had spread and a prostatectomy was indicated, although this caused a lot of anxiety in relation to after effects of the operation, such as erectile dysfunction and incontinence, which was my biggest fear, actually, the incontinence of urine. I opted in and I had the radical prostatectomy robotic on the 1st of December 2025. It's now the 13th of Jan. I've recovered well. I'm back at work. So within 6 weeks, I'm virtually dry, using pads for confidence really. Just got a bit of stress incontinence when I sneeze or cough. I'm back running, and it's quite a success really. My Gleason score's been readjusted to Gleason 9, 5 plus 4, following the histology reports. So again, waiting for PSA blood results. Hopefully they'll return 0. I'm actually not anxious about that at the moment. I'm quite positive. They left my lymph nodes. There was none in my seminal vessels. So hopefully, fingers crossed, it's done and sorted. But we'll have to wait and see, because you don't know with this illness. And it's terrible. I mean, 63,000, new diagnoses every year, 12,000 deaths. Most common cancer in men, 1 in 4 black men, 1 in 8 white men. So we need to do something proactive. I've raised £5,500 for prostate cancer in the last 2 years, and I'm walking up Snowdon to raise money in June. So I hope that answers all your questions. I'm 62 and otherwise fit and healthy. Thank you for your time.